Hello, my name is Peter Valadez, a nursing student at the University of Virginia's College at Wise School of Nursing, and today we will be discussing polymyxin B&E. Warning: this information is provided for healthcare education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult with a licensed pharmacist or healthcare professional before taking, administering, or changing an already approved or prescribed medication plan. Polymyxins are a class of medication used in the management and treatment of systemic infections caused by susceptible strains of multi-drug resistant organisms. 5 things the nurse should know about polymyxins. The first is 2 forms of polymyxin exist, polymyxin B and polymyxin E. The difference being polymyxin B is the active form of polymyxin, and polymyxin E is the inactive form of polymyxin. This medication can be administered by multiple routes: IM injections, IV push medications, and topically. For the purposes of today, we will focus on intravenous medication usage. They are bactericidal antibiotics, meaning they kill bacteria. They target gram-negative bacteria, and they are used to treat multi-resistant gram-negative bacteria. They are used as a first line of treatment for infections that are resistant to other antibiotics. Both polymyxin B and E are primarily used in clinical practice. In practice, you can also see polymyxin E written as colistin. Both have been FDA approved for the treatment of multi-drug resistant gram-negative bacteria, which include Pseudomonas aeruginosa, Acinetobacteriaceae, and carbapenem-resistant Enterobacteriaceae. Demonstrated on the screen here is a picture of each microbe. Shall the nurse receive a culture and sensitivity result containing one of the 3 microbes, they should anticipate the use of polymyxin. Polymyxins can also be used off-label and are commonly used in patients with cystic fibrosis to fight off infections. They can be administered as an inhalant and are often used on ventilator patients in hospitals to prevent resistant strains of pneumonia as well. Polymyxin induces cellular death by disrupting the microbial cell membranes, which leads to intracellular contents leaking out. Demonstrated on the screen here, you can see how polymyxin introduces its hydrophilic tail into the membranes of the microbe, which leads to cell lysis and intracellular contents leaking out, which causes microbial death. So both polymyxin B and E are used clinically and can be administered through intravenous infusion over a 1-hour period. However, the nurse should follow facility protocol. Polymyxin B is also administered topically via eye drops, ear drops, or topically on the skin. And the nurse should note that polymyxin E is the most preferred use for urinary tract infections. And lastly, polymyxin can also be used off-label via inhaled nebulizers and or injections. So the most common and clinically concerning adverse effect of intravenous polymyxin is nephrotoxicity, which has the highest incident rate. So signs and symptoms of nephrotoxicity that the nurse should constantly be monitoring while the patient is on polymyxin therapy include dizziness, numbness, slurred speech, tingling, vertigo, and neuromuscular blockade, which can lead to respiratory failure. You may also see hematuria, proteinuria, oliguria, and acute renal failure in patients with polymyxin therapy, which include these adverse effects. Some more rare adverse effects that you can see are hypersensitivities, such as rashes and fevers, and those who receive aerosolization polymyxin therapy, you can see bronchospasms as an adverse effect, so you should be cautious about that as well. Contraindications are those with a polymyxin hypersensitivity. Polymyxins require close monitoring during the administration of intravenous polymyxins due to the high frequency of nephrotoxicity. Nurses should closely monitor urine output, increase levels of bun and creatinine levels, and may require discontinuation of the drug if those levels do rise. In those using polymyxins in aerosolized treatments, monitor for bronchospasms, signs of neurotoxicity, and signs of paresthesia. When signs of renal toxicity are present, discontinue the drug immediately. Supportive care should be given, such as monitoring fluid intake and output, and electrolyte replenishment. For those in respiratory depression, cholinesterase inhibitors can be administered. Demonstrated on the screen here, you can see the nephrotoxicity effects of polymyxin. A demonstrates a 1-hour period in which the drug has no effect. B has a 4-hour period in which you can start to see some of the effects of polymyxin. C demonstrates a 24-hour period, and D demonstrates a 48-hour period. In treating multi-drug resistant organism infections using polymyxin therapy requires a team of healthcare professionals which include the following: nurses, laboratory technologists, pharmacists, and several physicians to achieve excellent outcomes. As nurses, it is our job to assess these patients for any potential toxicities, such as nephrotoxicity and neurotoxicity that may develop in our patients. The potential damage due to these toxicity depends on early identification. So as nurses, it is our role to monitor patients for adverse effects closely and determine the next best steps in treatment and care of our patients.